Good afternoon and welcome everyone. My name is Gerri Taylor and I'm one of the co-chairs for the ACHA COVID-19 Task Force. I'm also the former Associate Dean for Health Counseling and Health Promotion and the Director of the Health Center at Bentley University in Waltham, Mass. This is the third of our Ask the Expert series so far, and we've covered the topic of wastewater surveillance and also testing. The link to those webinars can be found on the ACHA COVID-19 resource page. That page also contains several latest updates and is a really valuable resource for all of you. Be sure to check your weekly ACHA COVID-19 emails, as they're also very helpful. And continue to use ACHA Connect, where you're helping each other, and it's fantastic. We appreciate all the input that you're giving to each other. Also, two announcements. It's not too late to register for the ACHA Health Equity Summit that's being held next Tuesday and Wednesday. You can find that registration on the ACHA website. And be sure to plan now for the second COVID-19 virtual summit scheduled for December 8th and 9th. Registration will open soon, so stay tuned for more on that. At any time today, if you have questions, please type them into the Q&A pane on your screen. We'll try to get to everyone's questions. A number of you have already sent questions in, and we're prepared to answer those as well. One last item, we're recording the session, and a link to the slides and the session will be sent to all registrants, as well as posted on the ACHA resource page. With that said, let's get going. I'm so pleased to today introduce our three speakers. Giving us a small school perspective on pandemic management, we have Andreea Baker. She's the nurse director of the Student Wellness Center at Concordia University in Nebraska. She's also the immediate past president of the Central College Health Association. Here to talk about medium-sized schools experience is Ilene Hofrenning. Ilene is a board-certified family nurse practitioner who serves as the director of the Framingham State University Health Center in Massachusetts. Prior to joining the staff at the health center in 2004, she worked as a primary care provider at a community health center in Worcester, Mass. Last but not least, here to discuss the large school perspective is Debbie Beck, the Assistant Vice President of Health and Wellness and the Executive Director of Student Health Services at the University of South Carolina. She has more than 10 years of clinical hospital experience and is serving on the COVID-19 Task Force for ACHA and is the incident commander for her university's emergency response team. So first of all, thank you all for coming and welcome. And I'm going to turn it over now to Andreea, who will discuss the small school experience of managing contact tracing, isolation, and quarantine. Andreea.
Thank you. Hello, happy Friday, everyone. So I'm going to talk a little bit about our small school perspective and just kind of how we've been managing COVID-19 at Concordia right now. Next slide, please. So we're about 25 miles west of Lincoln, which is the capital city in Nebraska. We have about 1,200 undergraduate residential students living on our campus, and our dorms were open with roommates this year as well. We're about half in-state students and about 50% out-of-state students on our campus, and we are a Lutheran Church of the Missouri Synod affiliated university. Next slide. So for us testing on campus, we actually just started testing this past week. We have a free service that we can offer our students. It's called Test Nebraska. And so we started doing this past week, and it's going well so far. These results are shared directly with the students, and then they will be encouraged or asked to talk to us about test results, especially if they're positive. And so making sure that we talk through that with them and what that would look like getting their test results. We're also working with our state right now to possibly get a rapid testing option, but we don't have that official yet. For us, our testing criteria are those students that are symptomatic or they have been determined to be close contacts. And those are our students we're testing right now. Next slide, please.
Sorry.
That's okay.
This one?
Yes, that's
Okay.
it. Okay, and hopefully everybody can hear me. We are only doing on-campus contact tracing, and we have a contact tracing team. We have our athletic trainers and our provider on campus, and we are the ones that are doing contact tracing. We only will be in contact with those students that are in our campus community. If through contact tracing, a student determines that they were around another community member or they were in any other businesses, they're asked to notify the local health department, and then the local health department will notify those businesses or those community members. With faculty and staff, we do very limited contact tracing on campus, and that is done through our human resource office, and they're only looking for information related to when the last time was that staff person was on campus. Otherwise, the health department will take over and do contact tracing. As far as the sharing of information, we will share without names to the direct supervisor to let them know that we did have a positive case on campus. Our student life office will then help initiate meals and housing, and will communicate with the students about that information. And I talk to the students about that process as I'm doing contact tracing and whether they're isolation or quarantine. Next slide. We are also using the Campus Clear app as a way for students and faculty and staff to report symptoms as well. Otherwise, they're free to just call us. We will check that momentarily a few times a day just to make sure that we're catching those that are reporting symptoms. And then we would notify those students or reach out to them to identify what's going on and see if they would qualify for testing. Next slide. So for us, we've had a total of 64 cases dating back to August 1st. We have had 59 that have recovered. I should have changed the slide because currently we have 6 active cases on campus right now. But at the peak of our semester, we had 25 in isolation or active cases at one time. And for us, that was quite a few, but that was back towards the beginning of our semester. And we did actually start the semester 2 weeks early. So we had at the most time 25. Next slide, please. So for quarantine and isolation, we do have space on campus. At the beginning of the year, we kind of looked at what was our residential offerings that we could have for those students who are living on campus. So only our on-campus students can quarantine or isolate on campus. So we did identify an entire dorm that we will use for quarantine and or isolation, depending on the floor. And then we've identified a few other areas on campus that are away from the main campus area for isolation, can be used for quarantine, but we mostly use them for isolation. We have about 9 to 15 beds for isolation, and we have more for quarantine. But we just looked at what did we have available for us, because we knew it was important that we did have some spaces for students to stay here. But we do offer isolation or self-isolation if they're waiting for test results, so we can move them to one of those designated areas. We do not require negative tests for students to come back. That is based off of our local health department guidance. So we follow the criteria that the CDC has given us for our positive cases. They have to be fever-free for 24 hours without any medications. They have to have improvement in respiratory symptoms. I typically ask if they have improvement in any of their symptoms or all of their symptoms. And then it has to be 10 days since their symptoms started. For our quarantine students, I touch base with them regularly through email or through phone, making sure they're not having any symptoms. And then especially as we're nearing the end of their quarantine period, we touch base to make sure that no symptoms have developed. Next slide, please. Like I said, I'm the one that typically is in communication with both our isolation and our quarantine students. And so I touch base with my isolation kids every day just to see how they're doing. And it's more of a care management approach since there's only 2 of us in the office. And so we touch base, make sure we refer them to one of our off-campus providers if they do need some medical attention. But we're just here to talk them through that. And as it's getting closer to the end of their isolation period, we talk through the next steps. And as I said before, they don't have to have a negative test to return to campus. Next slide, please. So I'll just briefly touch on the lessons we've learned. Patience is so important, and teamwork has been very helpful for us. I am very blessed to have a good working relationship with my health department. We call each other frequently. I have questions as situations come up. I've also been very blessed to have a campus that has given me a lot of support and a lot of cooperation in the prevention practices that we as a reopening task force put out back in July and August. And then flexibility has been really important for us because things continue to change, as we all know with COVID. So just a very brief snapshot of our small school perspective. So I would like to introduce Ilene to talk about our medium schools.
Thank you, Andrea. Good afternoon, everybody. I'm happy to share information and our practices of management that we have at Framingham State University. Next slide, please. Let me just tell you a little bit about Framingham State. We're located about 25 miles west of Boston. This year we have about 3,100 undergraduate students as compared to last year when we had 3,500 students in the fall semester. So we've taken a hit because of the pandemic. We have 720 residential students currently, and that's about 35% occupancy. 15 to 20% of our classes are in person. The rest are remote or online. We have 800 commuter students who are taking at least one course on campus, and probably about 1,500 that are taking all their courses remotely. And Framingham is considered one of the high-risk communities in Massachusetts, and that means that there is greater than 8 new cases of COVID per 100,000 population. Framingham is currently like 15 to 17 new cases per day per 100,000 pop. Okay, next slide. We have a testing program. We did onboarding testing for many of our students, faculty, and staff. We mandated it for all our residential students and also for commuter students who are taking courses on campus, and it was optional for faculty and staff to be tested as well. So we did about 2,100 tests for onboarding. Currently, we do weekly testing. Every Tuesday, we test all day, and it's staffed by volunteers from the FSU community. We test residential students, half the residential population every week. So every other week, every student who lives on campus is being tested. We also do a random sample of commuter students, faculty, and staff, as well as students and staff that are in high contact positions. We test them every week. In the health center, we do the symptomatic testing and testing of contacts. We have a very low threshold for testing symptomatic students. As we all know, COVID can present in many different ways, and sometimes it's very slight symptoms. I've had a number of people say, I thought it was just my allergies or a sore throat. We had one person whose only symptom was an earache, and it turned out to be COVID positive. Our turnaround time for tests is less than 24 hours. Oh, next slide, please. This is our our public-facing dashboard. It's very simple. The top graph has the number of tests that we've done each day, and the bottom graph is the number of positives that we've had. So the first third of the top graph is pretty much our onboarding testing. We did about 2,100 tests and we had 5 positive, 1 employee and 4 students. Since then, we've done weekly testing. We've done about 600 to 650 tests per week. The first week that we were doing weekly testing, we did 429, and this week we did about 750. And as you can see by the bottom graph, we really have not had very many positives. In fact, we went several weeks without any positive tests at all. The biggest number of positive tests that we had was our very first week of weekly testing, when we had 12 positives, and 10 of them were a cluster, a group of students that hung out together, were in each other's rooms, ate together. You know, it was one index case, and we tested the rest of them, and they were all positive as well and needed isolation. And then we had a contact trace for those students, but found no more positives. And 2 days later, we tested actually the whole rest of the dorm that had not been tested that Tuesday, and we didn't find any other cases. Next slide, please. We collaborate with our local public health department in doing both case investigation and contact tracing. We at the health center take a full responsibility for the case investigation, contact tracing on campus for students, faculty, and staff, because we can do the case investigation and contact tracing much faster and more efficiently than public health. If we get the results, we can easily contact students quite quickly. In fact, when we had the 12 positives, we were able to identify the contacts, test them, and quarantine them within 4 hours. So we could do that pretty quickly. Another thing that really helped us is last spring, when we sent our students home for spring break and they didn't come back, we were not that busy in the health center, where in Framingham, cases were surging. So 2 of us volunteered to do contact tracing and case investigation for the city of Framingham with the local public health department, which was really great because we got experience doing that, got training doing that, and also we're given access to Maven, which is the state surveillance system where you can input and access data about anybody who's been tested. Next slide, please. So the health center responsibilities, like I said, we do case investigation for any member of the FSU community, including students, faculty, and staff. You'll notify cases of the positive tests, evaluate their health status. Are they symptomatic? Do they have any concerning symptoms? And then place them in isolation. Before coming to campus, we had asked all of our residential students to have a COVID plan before they moved in. And that was if they needed to be in isolation or quarantine, was there someplace off campus that they could go to? We wanted them to think about that if that was a possibility. This was before the CDC came out and said, anybody who has to isolate or quarantine should remain on campus to prevent transmission in local communities. But the truth of the matter is our students tend to go home a lot. Most of our students come from within 2-hour radius of Framingham State. And so for them to go home is probably easier than other students. Having said that, we did find there's a lot of students that can't go home. We had one student who lives with her grandmother, and she was COVID positive, and we didn't want her exposing her grandmother. Another student whose mother works with a vulnerable population and didn't want to be exposed. We had another student who shared a bedroom with one of her siblings, and other students who don't have good Wi-Fi at home. And so if they went home for 2 weeks, they wouldn't be able to continue their studies. So, we ended up actually housing a number of students in isolation and quarantine. And then, identifying close on-campus close contacts, focusing on their roommates, suite mates, what classes they were taking, and dining hall, who they were eating with, how long they were sitting in the dining hall, and those kinds of issues. Next slide, please. And then we would notify close contacts. And students don't always respond to email and voicemail, but be on campus knowing if, where they live. We can involve Res Life in contacting the student and letting them know that they need to quarantine. Again, evaluating them for symptoms and arranging for testing. For contacts, we do testing in the health center as soon as possible, and then we repeat it again on day 5 to 8 when 90% of people have converted positive. If they're going to convert, they usually do it by day 5 to 8. I know some of our other schools in Massachusetts are doing testing on, say, day 9 and day 12 as well. But so far, we've just decided to do these 2 testings for someone who's in quarantine. And again, we check with the student about their COVID plan. Is it a possibility they can go home, or do they need to stay on campus? The local public health, they do the contact tracing and follow-up for any non-campus close contacts. Many of our students work in town. We have a mall the next town over where lots of students work, restaurants. And so the local Board of Health will do the contact tracing there if there was any exposure there. Or if the students have been home, the Board of Health in their hometown will do the contact tracing for their families and friends there as well. Next slide, please. And then, of course, monitoring and supporting all students in isolation and quarantine, both on campus and off campus. We do have a number of students that live in apartments off campus. And in fact, we have had 3 small clusters of infections at off-campus apartments. And so we have to consider housing. One of the apartments was 6 students living together in a 3-bedroom apartment. And by the time actually there's a Department of Public Health that was managing them. And, by the time they sort of separated them, 4 of them had been infected. Food, whether it's dining services on campus or making sure that someone off campus has food delivery. Laundry and mental health concerns. It's very difficult to be in isolation for 10 to 14 days. And so we've involved our counseling center and check in with students on their emotional health as well. Before the semester started, we had created an on-campus contact tracing team. It's 5 members of the Students Affairs staff. And they completed the Johns Hopkins contact tracing training. So they have helped with that, but actually we have found that they have been more helpful in monitoring and supporting students in isolation and quarantine, keeping up with the interaction with them on a daily or every other day basis. And then they have helped some with the contact tracing, but it seems like that's easier for the staff at the health center to do that, and using this team for monitoring and supporting students. Next slide, please. So my takeaways are, it's important to clarify your role with your public health partners. We've clarified that we're doing on campus and public health is doing off campus contacts. We did find it helpful for students to have a COVID plan and to be able to go home if possible, although we have many students that stay on campus. And supporting students in INQ really takes a team. It's Res Life, dining services, the counseling center, the contact tracing team, in addition to the health center. And managing COVID-19 on campus, Andrea alluded to this as well, really involves the whole entire campus in this kind of work, from testing to contact tracing to supporting and monitoring students in INQ. It really takes a lot of people and a lot of buy-in and assistance from offices all over campus. So now I'm going to turn it over to Debbie, who's going to talk about the large university.
Good afternoon, everyone. And thank you for joining us today. And it sounds like that Andrea and Ilene's got a lot of great ideas. So hopefully I can kind of add to some of that. So next slide, talking a little bit about the University of South Carolina. We were founded in 1801. We actually have 8 system campuses, and our Columbia campus is predominantly what I'll be talking about today, and it is our largest of the system campuses. And on our campus, we have about 35,000 students, with the system being overall about 52,000 individuals. We're in the middle of the city of Columbia. It's a very urban campus. And during the COVID period of time, we wanted to make sure not only protect our campus through our isolation and quarantine, but also protect our community. About 40 to 50% of our classes were offered in person, and the other 40 to 60% was offered online. So, or a hybrid of that. So there was a combination of those. Next slide. As we were beginning to look at our isolation and quarantine needs and our testing needs, we looked at an entire holistic approach to what we were doing. So we developed a risk mitigation plan. And of course, the containment measures that were the most important part is how are we going to test our students? How are we going to do contact tracing, quarantine, and isolation? And as part of this, we wanted to kind of predict of a large urban campus, how many students on campus would need to be isolated, quarantined? Would we be able to help assist with people who were off campus with quarantine and isolation? So as both Andrea and Ilene talked about, it was a team effort. Everyone on our campus, our community and local health departments kind of helped us with our planning to make sure that we were looking at the correct numbers. So the next slide sort of looks at one of the things that we wanted to make sure that we could do is if we were going to quarantine and isolate a high number of students, we have about 7,000 that live on campus. We wanted to make sure that we're able to meet those healthcare needs and be able to have the staff and the facility to be able to do that. And we, through our new health center that is now actually open up for 3 years, we were able to provide that routine and ongoing care for our students that were in isolation and quarantine. And we did that by doing our robust telehealth, telecounseling, and telepsychiatry. So that's sort of how we plan to determine how many can we isolate, how many can we quarantine, and what is the level of care that we would be able to offer. So the next slide is one that when we were looking at the numbers, we were saying, okay, well, based on the infection rate of our students living on campus, we are actually epidemiologists through our Arnold School of Public Health to help us develop scenarios. And they actually developed 96 scenarios. And it says how many students would be infected and at what point in time would they get infected. So the best case scenario that our epidemiologists told us is that we would have an uptick in cases probably late October, early November, but it never exceeded our resources. So we kind of looked at our resources and said, what do we have available? How many rooms do we have? The residence hall that we set aside for those, would we exceed that? And at that point in time, the best case scenario was no, we probably would not. So we thought, okay, well, that's our best case scenario. And then we looked at the worst case scenario, and that's on the next slide. So we took all 96 of those and we looked at the best and the worst. The worst case scenario was that we would have an immediate outbreak pretty early in the semester. We returned back to campus in the middle of August. So this scenario was within 3 weeks of students returning to campus, there would be a huge surge. And although the surge would be there, we would almost come to the point where we would meet our resources and have to think about, would we be able to handle that? But we said, well, the worst case scenario and the best case scenario are probably will not happen. So we kind of chose a scenario in the middle, and then we were able to develop the number of isolation rooms that we had based on that number. Well, unfortunately, the worst case scenario happened. We ended up having the outbreak very early on in the semester, and it kind of caught us all by surprise. So lessons learned is plan for the worst case scenario and hope for the best, because we planned for somewhere in the middle, but we did have a significant outbreak right when we first turned into campus. So the next slide we knew was really important was our testing. So much like Ilene, we also did pre-arrival testing. All students living on campus had to have a COVID test prior to arriving to campus. And that worked out really well. And we were able to do on-campus testing during the month of July and August. And we did that through our student health center, and it was the nasal swabs. At the same time, our College of Pharmacy was developing the saliva test. So we were hoping that that would get into play about the time that the outbreak happened. And they did. So we were doing about 1,500 saliva tests a day, and we were getting 200 to 300 positives a day. So it kind of, again, caught us off guard, but a lot of these students that were testing positive were asymptomatic. They had very little health issues, and that was sort of into our planning when we looked at the statistics across the nation is how many students in our age actually showed symptoms. So we felt like that we were going to have a lot of those that were asymptomatic, and we did. Probably more than about 60 to 70% of our students had very little to no symptoms. Although when we started going into the contact tracing, we discovered, well, my food didn't taste really quite as well. I had a stuffy nose. So as we got through talking with them, it does appear like that they had a little bit of symptoms that were available. One thing that really helped us during this period of time, we had the outbreak. Our student government president, she did a phenomenal job working with our city, and we did a campaign called I Pledge Columbia. And it was asking students, faculty, and staff to take a pledge that they would get tested often, they would practice the mitigation strategies, they would maintain the isolation and quarantine boundaries that were set if they did test positive. And this really helped us a lot. It helped us to contain the virus when we did have the huge outbreak. At one point in time, we probably had about 325 that were actually on campus in isolation. So again, it was pretty overwhelming at that point in time. But this is where the teamwork came in. Our housing, our student success center, all of our student affairs, College of Pharmacy, School of Public Health, we all came together. We were working around the clock, but we were able to manage that outbreak and contain that before it got much worse. We are continuing to do our testing now. We do testing every day. We are doing about 650 to 700 tests a day right now, but our testing capacity now exceeds our demand. So originally, when we were in the outbreak, we could not have enough tests available because more and more students wanted to get tested. Now that we have our testing capacity really high, then students and faculty and staff are not getting tested as often. So obviously we can back down on our isolation and quarantine. We had one residence hall that had about 190 beds that were single beds. If we had to double up, we could, so that would give us about 300 beds in that specific facility. So then we looked at getting an alternate facility, which we were able to get a facility right next to campus, walking distance, for about another 100 beds. So those two areas filled up fairly rapidly during this period of time. So as the second residence hall started filling up, or the quarantine space, then we were able to go into a local hotel that is very close to our campus. So all of these things were going on at the same time. So, Ilene talked about lessons learned. As you're predicting how many isolation and quarantine rooms that you have, double that, or at least increase that by 30–40% just in case to have that outbreak. So it was very good that our community worked with us to be able to secure those extra facilities. Unfortunately, the communications and the media felt like that was a problem. So there was a little bit of a media and bad publicity that we had to manage. And I think our campus did a really good job because it was meeting the needs, although we did have to expand that isolation and quarantine out. So our testing right now is continuing with our asymptomatic, symptomatic surveillance. And we're also doing wastewater monitoring. So we were doing this very early on. And whenever we had that massive outbreak on campus, our wastewater was really hot. We had almost every place on our campus was showing high levels of the viral load. Well, after we were able to contain that and the cases came down, so has the wastewater. But we have what is called Go Team. So we monitor that on a daily basis. And any point in time throughout our campus that we see a particular residence hall that is actually increasing in the viral load, we will send a Go Team there to be able to test that resident hall so that we can kind of catch that very early on. So this has been one of the things between our School of Public Health and our College of Pharmacy has been really instrumental in helping us to control the outbreak. The next slide is sort of looking at one of the things that we were able to do with our testing is we were able to set up within our electronic health record sort of a clearance. It's much like immunization. So we were able to set this up through our COVID-19 test results. So when students uploaded their test result, it was able to turn it into a compliance, and we knew who on campus had actually tested positive, who had an antibody test, or who tested negative in order to manage that. So it worked out really well within the electronic health record. The next slide is sort of looking at our isolation and quarantine sort of as a summary. Is again, we had to do the identification of the space and we estimated the number of the beds, and we kind of talked about how we did that. We did it looking off of a medium level of our scenarios. Also, as Ilene mentioned, all of our staff did the CDC and the Johns Hopkins contact tracing. We were able to use the formula provided by Johns Hopkins to say, if we think that we have this many students on campus, this many will need isolation and quarantine, how many contact tracers will we have? So we were able to scale up our contact tracers based on that formula that we used. The other thing, as I said, we partnered with our Housing Student Success Center. When we had this significant outbreak that occurred on our campus, our Student Success Center came to sort of our rescue. They were doing the initial calls at telling people, you know, you've tested positive. We have a case manager that's going to be reaching out to you in a couple of hours. What can we do for you? Letting them know, where are you? So it was very helpful to have those individuals to work with us on that. We also worked with our local DHEC department, and we decided at that point in time we would handle all the contact tracing, isolation on campus, and they would help within the community. So we were talking each day and trading students and test results back and forth so that we could maintain what was on campus and what was off campus. We had our own staff doing all the case investigation, and again, mentioned the contact tracing. One of the things that got also a little bit by surprise is the isolation and quarantine transportation. We had a lot of staff that were afraid to transport a COVID positive individual. So we had to kind of look at some alternate transportations. And fortunately in Columbia with the weather, we were able to use golf carts and be able to move patients from the residence halls into the quarantine isolation space because the weather was so good. So that was something that we also learned, is that, you know, that fear and the anxiety of individuals. So that's something that we would want to do in the future, is to continue with the golf cart. The case managers, we actually took our Healthy Campus initiatives, and all of our health educators actually completely moved into this role as case managers, and students were assigned. So if a student tested positive, they were automatically assigned a case manager, and they had access to that case manager 24/7. Some of the difficulties in the case management is students wanted to be engaged. They wanted to leave the isolation area. They wanted to visit friends. And obviously that couldn't happen. So that was a little bit complicated throughout the period of time. Also mental health. So fortunately through our telemedicine and telecounseling, we were able to provide that service within those isolation and quarantine areas. One of the things when a student was in isolation and one of our providers felt like they needed to be seen in person, once again, we had that complication of how do we transport somebody who was sick and contagious into the health center. So we had to work through those as well. One of the things that surprised us the most is obviously students were delivered meals 3 times a day into those isolation and quarantine, but the students were accustomed to the meals that they wanted. So basically, the majority of the parents started ordering food, catering food to our isolation and quarantine, and it sort of overwhelmed the case managers and overwhelmed the housing staff, because now we had to worry about how do you deliver people, you know, Grubhub, and they were getting care packages. So that kind of got a little bit complicated. And then we had students that went into isolation and quarantine, and like Ilene mentioned, we said have a plan, make sure that you have your over-the-counter medications, you have your Tylenol, you have your tissues. The far majority of the students did not take the Tylenol and the things with them. So we had to set up a system where we were delivering those over-the-counter medications as students requested that. Our medical monitoring was done by our nursing staff, and we were also able to do that through our electronic health record. We were sending out daily monitoring surveys. They were able to fill that out, and it came into the nurses. The nurses were able to prioritize that based on the symptoms, and they were able to provide that on a daily basis. A lot of students ignored that medical monitoring. So we got our student conduct involved, and they actually sent out an email and said, this is really something you have to do. If you are in quarantine or isolation, you must respond to this medical monitoring. And then we had a much higher level of compliance when we did that. So as students were getting ready to be discharged out of isolation and quarantine, they had to kind of go through a nurse to get kind of checked out so that they could leave quarantine and isolation. And during this period of time, we had several students who wanted to be tested inside quarantine, and we did that somewhere around day 5 and day 7. We wanted to make sure students understood at that point in time, even though they tested, they were not getting out of quarantine any earlier, but it also helped them because they thought, well, if I test positive, then I get out of isolation in 10 days, Whereas if I don't, in quarantine, it was 14 days. So they were actually doing the math. So that was kind of interesting. So even if they would get out of quarantine a day early, they wanted to be tested because that day really meant a lot to them. The next slide is just sort of an illustration of our contact tracing app that we were able to utilize through our electronic health system. So when someone tested positive, we were able to put them in there, put everybody who was in contact with them. And then we had the first line who were the immediate contacts and then who needed to be looked at a little bit later. So that worked out really well. The next slide sort of shows an illustration of what that electronic health record looks like when you pull it up. The bottom slide is the slide where we had the height of our outbreak. You can see all the people that are in red were those that were testing positive. Those that were green were the ones that were recovering from the ones who tested positive. And then the blues are the ones that were being actively traced. The diagram above that is what happened after that surge was over with. You could see that we had lots of people that were healthy at that point and had recovered. At this point in time, we're looking at antibody testing, and we know that that may or may not mean anything, but we're taking these individuals that had tested positive and tried to determine what that antibody looks like. And the next slide is our dashboard. And you can see since August 1, we actually reset our dashboard as of August 1 as students were moving back in. We've had a total of about 2,500 cases. Currently, or as of yesterday, we had 22 cases, and today we have about 58 cases. One of the things we wanted to make sure is to be very transparent on our cases and what percentage of our students were testing positive. The bottom graph, if you go to our website, you can kind of look at our campus alert factor. So we looked at all of these things that we wanted to say, is the campus prepared? How well are we managing COVID? And we developed this matrix, and we were able to put a score on it, kind of determining what's happening. Contact tracing and isolation were huge components of that and was a very important part of monitoring how well our campus was handling the outbreak. If you see to the far left-hand side, right now we have 99.7% of our isolation beds available because we have very few people on isolation and quarantine at this point in time. So at that point, I can turn it back over to Gerri and we can answer some questions that you may have. So thank you for joining us today.
Thank you so much. Our speakers have been fabulous. So much information, and to learn what's going on at the different types of colleges has been really helpful. I have a number of questions, so I'm going to go as quickly as I can. Debbie, I wanted to ask you, how far back did you go with contact tracing? You're on mute. There you go.
Yes, the contact tracing, we went back, depending on the student, it was 48 to 72 hours, because sometimes the students were going to say, well, I really don't remember. Well, let's go back 72 hours. So if they were very clear at where they had been, who they had to get contact with, whether they had a mask on or they did not have a mask on, but for the most part, it was between 48 and 72 hours that we were going back for those contacts.
Thanks. And you also, we had talked yesterday about how do you calculate the number of isolation and quarantine beds, and can you just make a comment about that?
It was very difficult to calculate. One of the things that we looked at, again, that worst and best case scenario, but what we did was we knew that we had 190 beds that were available. We went back and we looked at H1N1 and we said how many positive cases that we had. So we predicted that we needed about 290 beds for isolation and quarantine, and we ended up needing about 350. So we were probably off at about 60 beds.
Thanks. Ilene, somebody asked, how did you have so few cases? To what do you attribute that? Was it prevention? Was it mask wearing? What do you think? Ilene, you're muted. Sorry. Go ahead.
I do that all the time.
There you go.
Well, I think part of it is that we're just lucky to live in Massachusetts, where even though cases are rising right now, they tend to be on the low side. You know, I think that's because a lot of schools also have fairly low cases as well. I mean, I think it is part that our students are buying into some of the mitigation strategies. I mean, I'm really surprised when I see mask wearing, especially outside, because I don't necessarily wear a mask outside. I feel like the chance of transmission is really low. But I see students who are going for walks on the campus who are continuing to wear masks. So I think that makes a difference. Otherwise, maybe it's because it's warm weather. I'm worried about late October, November, December, when people are moving inside. I think we will see an increase at that point.
Thank you. We have a lot of questions about testing. So one question is, whoever wants to answer it, for symptomatic students, are any of you using antigen-based testing? No. Debbie?
Yes, we are. For the symptomatic, we are using antigen-based testing, but we are backing those up with PCR, and we're seeing a pretty good correlation with that. So we feel like it's pretty accurate.
Debbie, which antigen test do you use?
I don't recall.
Okay.
I will look that up and send that to you, Ilene. I think it's Sophia, but I wanted to make sure that that's accurate. I'm like 90% sure it's Sophia.
Okay.
Because I am familiar with some schools that just don't have the capability of testing. They're getting 2-week turnarounds with the antibody test, and they're thinking maybe they should start using some of these antigen tests. May be helpful. Do you share results, Andrea? You've got such a small campus. Do you share results with anyone else on campus?
Only our athletic trainers, but most often they already know if they're athletes. They'll know ahead of time before I do sometimes. But that's really the only other department. Our student life knows the name, but it's put in by myself for housing purposes, and that's all. I don't share any other information with anyone else on campus.
Thanks. How about you, Ilene?
No, only with housing if they need to be in isolation and quarantine. And athletics,
Deb,
that's true
for you?
well.
Yeah.
Yes, only those that are needing to know for the contact trace or for the isolation and quarantine. We provide de-identified data, but not the individual students.
Thanks. It appeared to me in Massachusetts where they were doing a lot of pre-onboarding testing. So students were required to have a negative test prior to coming to campus. Have you found that the case in your 3 areas? And if so, what kind of testing are you using or accepting from students coming on?
So for us, we didn't do any onboarding testing. We had discussions about it, but we kind of landed on not having anybody do testing before they came to campus. I don't know if that was right or wrong, but that's where we.
How about you, Ilene?
We did onboarding testing for, we mandated it for all residential students. So that was 720 students. And then also we recommended for commuter students that had classes on campus to be tested as well. And many of them did come in and get tested. And then we had an optional for faculty and staff. So we did a total of 2,100 onboarding tests. We did the PCR test, with the Broad Institute that has the 24-hour turnaround time. So it worked out really well.
How about you, Deb?
For pre-arrival that we actually conducted was around 12,000. And then all students that lived in the residence halls had to upload either a negative test or a previous positive, and we accepted whatever they had from the community, but it had to be within 14 days of arrival. And that wasn't optimal, but we knew that students could not get tested at that point in time. Moving in the spring semester, it's everyone who's on campus and in the residence halls will be required to be tested, and we're going to pull it down to 5 days before arrival.
Great. How about payment for testing? People are asking that question. Deb, why don't you start?
Did you say payment?
Yes.
Yes.
They were all free. We're not charging, and it came
Covered
through the
by the
CARES.
university
Yes, and through the CARES money. Yes.
through the CARES Act. How about you, Ilene?
Yeah, we're not charging students for it at all. The university is paying for it. It's $25 a test through the Broad Institute that many universities in Eastern Massachusetts are using. But we just got money from the state of Massachusetts that's going to cover most of the testing for at least this semester.
Great.
So yeah.
Andrea?
So the testing that we're doing now is through what our state calls Test Nebraska, and that's a free testing for anybody in the state. We just are a on-campus site, and thankfully our turnaround time has been less than 24 hours.
Wow, that's great.
Get a PCR test. And even the rapid that they're looking at doing would be free also for students. So.
Great. Some people are asking for the COVID plan that you asked students to have coming in, Ilene. I'm wondering if you would be willing to share that, if that would be possible.
Well, mainly that was just if someone needed
or the
to be...
questions. Yeah, kind of the questions you would ask them to look at.
Oh, okay. No, so but we asked them if you had to isolate or quarantine, is there some place that you could do that off campus if necessary? And what kind of, how would you what kind of transportation would you use to get there?
Okay, thank you. And the screening forms, if anyone has any screening forms, people would appreciate those. So let us know and we could attach that to the slides.
Okay.
Are you seeing a difference between off-campus students and residential students? Does anyone want to address that?
I feel like initially we had more off-campus students that we had a higher positivity rate. At that time, we weren't doing testing, so I can't tell you specifically what our positivity rate was, but it's kind of started to shift a little bit now where we're seeing more on-campus students that are testing positive. So, and our community around us also is increasing in cases as well. So I think that's having an impact on ours as well. But for right now, it's kind of been 50-50 where we saw off campus initially, and now it's shifting more towards on campus. So.
Okay. What about the students with upper respiratory illness? Are you quarantining them while awaiting a COVID test return? Yes. Everybody's shaking their head. Thank you. And how are you enforcing quarantine or isolation for that matter? Ilene?
Well, we have, we put students who are in isolation quarantine in a separate dorm, and they do not have card access. If they leave that dorm, they wouldn't be able to get back in, and they don't have card access anyplace else on campus either. So that's pretty much how we've enforced it. Initially, when we had our first outbreak, because some of the students were roommates or they were suite mates, and so they weren't in the same room, we let them stay in their own dorm room initially, and then realized that was not going to work, that there was just too much going back and forth. And so putting them in a separate dorm made it easier.
We've also been hearing in Massachusetts of some of the schools giving students time to go outside. Are people doing that as well? Ilene says yes. Andrea,
well,
how
no,
about you,
actually, we haven't.
No.
I'm
No.
just shaking that
No.
yes, because I was thinking and I just brought this up recently with the Res Life director, is that this is important. I mean, if I was inside for 10 to 14 days, I go crazy. So we are going to be working on that, on trying to allow some time outside.
Right. You might mention what Framingham has done under the tent outside. Not for quarantine or isolation students, but just
Yeah, we have a big tent that's in an open area. You know, it has, you know, probably 30 or 40 different chairs, kind of spaced 6 feet apart, and actually little tables there too. And it's good Wi-Fi up there, so students can socialize, they can study, you know, use internet up there. So it's a good way to be outside and interact with other people, but still be safe.
Nice idea. Listen, we only have a few minutes left, but I'd like to ask you guys to each have a turn to say something about lessons learned. Is there something very positive you'd like to share with people, or something that you would do totally differently the next time around? Why don't we start with Debbie?
I think one of the things that I would say that didn't surprise me, but was something that really got us through this huge outbreak, is the love of college health, the love of student affairs people. I think college health offers a very unique opportunity for students and for a campus to provide that quality health care. And I think that was just a real pleasure in the midst of the chaos. I think that was really important that we have so many people that do that. And I've heard that campus-wide and nationwide. And I think that, again, is just looking at the predictions, looking what's going to happen on your campus, how can you do things better, and then realize when you didn't get it right and say, okay, well, how do we get it right the next time? So celebrating successes and working on those things that didn't quite work out the way you wanted them to.
Excellent. And not taking it too hard, because it's such a novel situation that we're all dealing with. Ilene?
Well, kind of what I mentioned at the end of my slides is this really is a whole campus-wide mission to manage COVID-19. I think at the beginning, I really thought in my office, we thought it was sort of like the health center thing that we have to manage. But it really takes the whole campus from, you know, administration, student affairs, res life, business, I mean, everybody. You know, for our testing site, we have lots of volunteers from all kinds of different offices as well, working together on it. We wouldn't be able to do it without them. So I think it's really important making sure that everybody on campus knows that it's campus wide. Everybody has to, you know, help, has to buy in, has to be there to do what needs to be done. And I also think that kind of what both Debbie and Andrew were saying, you need to be flexible, you know, and nimble in terms of, and just being ready for what's coming, because we really have no idea.
Right. Excellent. How about you, Andrea?
Yeah, I agree with Ilene. I felt a little bit at the beginning like, oh, this is going to be a lot on my shoulder, and I'm going to have a lot to do. And I was really grateful that the campus has really stepped up. I can say I don't always get out of my office as often as I would like, but we have a campus that will communicate things with me, and I have administration that's been very supportive and encouraging, and we've had a lot of really good discussions. So teamwork really has made this, I think, go as well as it has. And we also have a lot of student buy-in too. Our students are pretty incredible, and, you know, they want to be here. And so they're willing to do the things that we ask. And they really are positive about all these changes. And that is one of the best parts about being in college health, are the students that we get to take care of. So yeah, teamwork is very important. So.
Thank you all so much. This has been absolutely terrific. And it just highlights how excellent our college health centers are, and the hard work all of you are doing. We really appreciate, and as do the college students and their families and the administration. Ask the Expert series will be back on November 6th, where we'll talk about the mental health needs of students, faculty, and staff during the pandemic. And if you have suggestions for topics, do let us know. And be safe out there. And thank you so much to our presenters and to our participants. Thank you.
Thank you. Bye, guys.
Thank you.